This is One on One.
When Phillip and Michele first married, they had everything to look forward to, including starting a family together. But as the years passed, it became clear that their journey would take a different course.
It took us a long time to be pregnant. We tried on and off for literally 7 years. There was parts of our lives that we were just going to give up. We were just going to say, you know what, we're happy where we are, and let's travel. So we went to go give it one last shot. And it worked, but then it didn't work to perfection, the fairy tale that everyone's looking for.
It was early on in Michele's pregnancy when she was referred to the maternal fetal medicine team here at Virtua, led by Dr. Shailen Shah. Like so many other women, she came here scared and unsure of what the future held, but hopeful that this pregnancy would end with the joy of new life.
At 16 weeks, we got the first inkling that something's really off here. Baby B isn't growing the way that she should be. Baby A looks good. She looks great. Baby B, on the other hand, a little small. The 20-week anatomy scan. And you go home and you're like, just get me through the 20-week anatomy scan. Make sure that, they have 10 fingers and 10 toes and everybody's good. And that's when the shoe dropped. And it was, we really need to monitor you.
Maternal fetal medicine monitors patients with conditions such as obesity, diabetes, heart disease, women with preeclampsia, autoimmune or genetic disorders, and for age, women who are over 35, or, like Michele, who are pregnant with twins.
How are you? The two most important things I monitor from the baby's point of view is the weight and growth of the baby, because a baby that's growing well tells me that that placenta, the organ that delivers oxygen and food and nutrients from mom to the baby, is functioning well. The other thing is the baby's movement, because that also tells me, just like us, when we're not feeling well or we're winded, we want to rest. We don't want to move. Babies are no different. So a moving baby tells me that the baby is happy. From the mom's side of things, I am alerted to if her symptoms outweigh what would be normal for a pregnancy. Of course, it's normal for a pregnant mom to have some back pain or be winded, but it's not normal to be short of breath as they're walking from their car to the doctor's office or lying flat to go to sleep. Bleeding is another big issue. Usually spotting is innocent, but sometimes it's not. And it's not just heavy bleeding that can threaten a pregnancy.
In Michele's case, IUGR, or intrauterine growth restriction, was the reason why her twins were not growing the way they should be.
We did have a scare where one of the things with IUGR is, does the blood flow stop? Even if it's for a split second, does the blood flow stop? And there was a visit where, for a split second, her blood flow from the placenta through the umbilical cord stopped. And I could see it. And I remember looking at him and going, that's it, it's over.
Michele later learned that the blood flow stopped because she was in the middle of a contraction. But in that moment, she says she was devastated.
I cried on Dr. Shah's shoulder for probably 20 minutes and then was like, okay, we're gonna do this. And we came back and the blood flow wasn't great, but it was better.
How did they deliver that news to you? How did Dr. Shah, how did the team here tell you that?
With a bit of sadness, but with a bit of compassion and going, this happens all the time. This is common, it's just not talked about. We're gonna be okay. You're gonna be okay. Maternal fetal medicine it's them. They're the patient. But mom's a patient too. And to have Dr. Shah really make me feel like I mattered and answer any question from every medical journal that I might have read, we walked through it step by step.
What did that reassurance in times of incredible stress do for you and your husband?
It made you feel like you were a human. It made you not feel like you were I'm just one of 500 patients they saw today. I mattered. My girls mattered.
As my a famous partner used to say, the neck up matters as much as the neck down, and no truer words could have been said. I treat patients like I would treat my family members. I talk to them in layman's terms about what's going on. I help them understand the physiology. And I tend not to tell patients what to do. I rather engage them. I'm certainly their advisor, and there's times I say, this is the right thing to do. But most things in medicine can be a discussion rather than a dictation. Michele really wanted to understand the background, not just what we saw in ultrasound, but why that led us to the conclusions we did. So the more information I gave her, it empowered her to do better research. And it empowered her to ask me better questions.
Dr. Shah believes that patients are very often the first ones to know that something is wrong, and he says they need to be their own advocates.
At 32 weeks, I just didn't feel right. I started to be really lethargic and really tired. I was itchy. I was super itchy. I was super tired. I was super swollen out of nowhere. It was just a totally different feeling that I had had. And then it was at that next visit when I was like, something's not right. We did some blood work. They took some liver numbers. They did a protein culture, and my numbers were through the roof. My liver wasn't functioning. At one point, my liver numbers were 10 times what they are on a normal level, which meant bile was backing up into my system. And it could make the kids really sick, and God forbid, we could lose them. And I knew, as much as I didn't want to believe in it, that these babies were coming at 33 weeks.
I was out in the hallway with the doctor that was delivering, and was told to was told as you may have to make a choice. So because they have to go in and take the babies out right away, and we have to go now because your wife's liver levels are 10 times what it's supposed to, and she may lose a baby, both babies, or we may lose her. And that one, still can't wrap my head around that one, still to this day.
So very often women will come to you after they've seen their OBGYN after they're pregnant. You advise women who could potentially be high risk to come and talk to you because you may be able to actually help them before the pregnancy?
Absolutely. I can be most effective preconceptually, both medically in optimizing their health and also from a psychological and emotional point of view, easing their anxiety, or in those very few patients, maybe suggesting that we look at different avenues. Many times we can tell women that despite their high-risk condition, despite their lupus, despite their heart disease, that with proper management they can have a healthy outcome.
And that's exactly what happened for Michele and Phillip. They welcomed two beautiful baby girls that day, Peyton and Piper.
They were 3 pounds and needed some respiratory support to get them upstairs to the NICU. It was scary, and a lot of it's a blur, but I do know that I'm fortunate enough to have that picture, that first family photo of all 4 of us. We're just so lucky. We're just so blessed in the things that medical science can do and ensure that they're okay. You're just grateful. You just stare at them and you're just like, oh, look. Or this could have been a much different situation. But it's not. I have 2 very healthy children that, yeah, there's stuff. And there will be stuff. They were preemies, and we fought a lot of battles throughout, but that doesn't matter. They're here, and for all intents and purposes, they're healthy. And they're amazing. Over the holidays, we took a picture, and they were happy, and they were, and I had to send it to Dr. Shah and say, thank you. Because without you, this wouldn't be. This wouldn't be.
One-on-One with Steve Adubato has been a production of the Caucus Educational Corporation, celebrating over 25 years of broadcast excellence. Funding for this edition of One-on-One with Steve Adubato has been provided by the New Jersey Office of the Insurance Fraud Prosecutor, New Jersey State Nurses Association, and the Institute for Nursing, Johnson & Johnson, the North Ward Center, Adler Aphasia Center, Verizon, and by the law firm of Gibbons PC. Transportation provided by Airbrook Limousine, serving the metropolitan New York, New Jersey area.